Bismillahirrahmanirrahim. Assalamu alaikum. Today we will be starting from a very interesting clinical scenario, and let's start with that. A 2 years old child has been brought to outdoor for complaint of intensely itchy lesions on the body, especially hands, groin area, chest, abdomen, and back. The mother is telling that child becomes much irritable at night to sleep and keeps on scratching all over the body. Mother is also giving history of two other siblings with a similar complaint at home. Family is from a lower socioeconomic status and all six family members they live in a common room. On examination, there are multiple red papules in affected area. There are vesicles and wheals over the body. And here is the appearance. Here is the appearance of these lesions. On the left side, you can see what is the appearance of the lesions, and similar is a picture on the right side, making a burrow below the skin. So let's see is what is the diagnosis. So it is a very typical case for scabies, and my name is Dr. Rizwan Goher. I am working as consultant pediatrician at Lahore General Hospital. So let's see what scabies is. There are certain learning objectives of this talk. The first one is to know about the clinical presentation of scabies and to identify the characteristic lesions in scabies, and we should be knowing how to make a prescription for management of scabies. Here you can see the bug. The bug for scabies is called Sarcoptes scabii. Here you can see a hemispheric body of a bug, which is also having 8 legs and a brownish spine in the mid. And this bug, Sarcoptes scabii, or it is also called mite, this forms tunnels below the skin, or it actually burrows the skin where the female might hatch the eggs, and due to this burrowing or tunneling, the severe antigenic reaction may start, and there can be severe itching. The cause of itching is antigenic nature of this bug, the feces of this bug, the ova, and then there can be formation of larvae that cause severe and intense pruritic reaction, and the child is unable to sleep at night. And the characteristic thing is that there are other family members who are also affected. So the mite that is causing this condition is called Sarcoptes scabii, and the transmission is not airborne or something else. It is via the skin to skin contact, using the similar cloths, using the similar linen, blanket, pillows, or other cloths. So it is due to intimate prolonged contact. There is no gender predilection. It can be of it can affect either sex. It can occur at any age, and usually this infestation occurs in low socioeconomic status with poor hygiene and overcrowding. So as we have seen the clinical scenario, that the predominant symptom of this infection is severe itching at the area that has been affected. It can be axilla, it can be groin areas, it can be chest, abdomen, back, and it can be the interdigital spaces of hand and feet. So the characteristic of this itching is that it worsens at night. It becomes more severe at night than the morning, and many other siblings of the similar family can be affected with a similar complaints. So there are two characteristics points. One is severe itching at night. Second is history of similar members who are affected with these scabies. So these two are characteristic feature. Family history, severe itching at night. And you can physically see the burrows on the skin that is pathognomic for this Sarcoptes scabiei. So this burrowing is only formed in scabies. So first one is severe itching at night. Second one is similar family members having similar complaints. Third one is burrowing below the skin. Here you can see this is the skin, these are the hairs, and here that bug is causing burrowing, and here is the female Sarcoptes scabies, and this Sarcoptes scabies is hatching eggs. Here you can see the eggs, and here is the fecal matter. The severe allergic reaction is due to this burrowing, due to these eggs, this fecal matter, and at the end, when this female mite hatches many eggs, then there is death of this female Sarcoptes scabiei, and the death also leads to severe hypersensitivity reaction as a result of release of different chemicals from the body. So ultimately the larva, these eggs are hatched, and the larva, they move to the skin, and then they complete their life cycle, and then they infect another part of the skin. So generally these patients come to you after visiting different general practitioners, and they generally apply steroid over the skin. There can be temporary relief of redness and itching from steroid creams or lotion, but the underlying bug remains there, and there will be recurrence of the symptoms. And what is the morphology of these primary lesions? As I have talked about previously, that this bug burrows within the skin, that is pathognomic for scabies. Here you can see the burrowing, and here you can see the affected area as well. And this burrowing appears at serpentine or thread-like. Serpentine means that the shape of this lesion or burrow is like a snake that is turning around like a thread. So the length of this burrowing can vary from a few millimeters to a few centimeters. Although this is a primary infection by a mite, Sarcoptes scabiei, but as a result of itching and severe itching, there is abrasion of this normal skin, which is acting as a barrier to different infections. So when this barrier is away as a result of severe itching, there can be secondary bacterial infection of the skin. There can be formation of pustules, there can be impetigo, there can be folliculitis, there can be carbuncle, and there can be eczema of the skin. And at times there can be severe cellulitis of whole of the affected area. And similar nodular lesions can also be seen on the genital areas. On the left side, On the upper side, you can see the scabies in an infant with multiple papulo. These are the papules, papulovesicular lesions over the palm, and with few crusted lesions as well over the palm. So there is also surrounding redness of the area. Similarly, we can see these nodular lesion over the scrotum nodules. Here you can see the nodules of the scrotum on the penis. These are the multiple nodular lesions which are seen over the genitalia. The area of involvement in scabies, right? Here you can see the highlighted area that can be affected. Here you can see that face, neck, and scalp that that is generally spared in adults, but in infant there is some difference. There can be involvement of neck, there can be involvement of face as well as scalp. That is uncommonly seen in adults. So this is the main difference between these scabies and infants and adults. Rest of the area you can see that all these area can be involved. So here you can see the burrowing. This is a burrow that has been formed by Sarcoptes scabiei, which is pathognomic for this infection. And the diagnosis is majorly clinical, with a history of severe itching at night, family history of a sibling with a similar complaints. Then, if you need confirmation, we generally use the scrapings of the affected area and we see that under the microscope. So here you can see the eggs of the female mite, and here you can see the bug. There is formation of Sarcoptes scabiei. So if we talk about the treatment plan for such patients, the treatment plan is we apply a certain medicine that is scabicidal below the neck, all over the body, um, and all the affected areas are uh, treated with the application of this scabicidal cream or lotion, including the genital areas, sole of feet, palms, interdigital spaces. And the main important thing is that we have to treat all the family members simultaneously, even if they are asymptomatic. So this is a key point to remember, that all the members of the family, they have to be treated even if they are asymptomatic. Similarly, we remove all the linen or the bed sheets or the pillow covers, all the blankets, and we wash them in warm water and then make them dry to remove this bug from that place. And if there are certain clothes that cannot be washed, that stuff twice, then we can enclose them within a polythene bag and we can keep them separate for 5 to 7 days. This will lead to starvation of this mite, and after 7 days there will be no more bug because they cannot survive for 7 days without eating anything. The itching may last for several days even after application of the proper lotion or cream, because the antigenicity and the dying bug can also cause severe allergic reactions. So it may take even up to 10 to 14 days for complete resolution of the itching. So for itching, we generally give the patients antihistamine in the form of cetirizine, loratadine, chlorpheniramine. There are different formulations which are available, so they can be given to relieve the sign of itching. Similarly, there is an antipruritic lotion that can be applied over the skin that comes with the name of calamine, that is a OTC over the counter medicine that can be applied to relieve itching. So coming to the specific management for scabies, the treatment of choice in the treatment is permethrin 5%. So 5% permethrin is a treatment of choice to relieve scabies. So we apply that at the time of bed, all over the body, below the neck, all the areas. We take some time to apply the medicine. We'll make sure that each and every area of skin has been applied with this medicine, and this application should remain there for at least 12 hours. So in the morning, once the 12 hours are completed, we can advise the patient to take a bath. So this can be repeated after 1 week. So first application and then second application after 1 week. Similarly, permethrin 1% is also available, that is used in the treatment of H infection. This is your assignment, you have to see that, where 1% permethrin is used. Then there are other formulations available like benzyl, benzoate, cortamitone, which comes with the name of scabion, and ivermectin, and other sulfur combinations. They can also be used. The treatment of choice is only permethrin. So this is a poison. This has to be kept away from the infants and children. So all the safety measures should be taken into account to avoid accidental poisoning with permethrin. There are some patients who have severe infection and severe symptoms, or there are certain patients who are immunocompromised. So in that case, we can use over oral ivermectin for the the relief of severe symptoms or in patients who are immunocompromised. So there are two doses with a 200 microgram per kg per day, the first dose, and the second dose is 2 weeks after the first dose to relieve the severe symptoms. As we have talked about that, what can be the complication of scabies? Apart from severe itching, there can be secondary infection of the skin with Staphylococcus aureus and Strep pyogenes, and there can be eczema of the skin in infants. Here you can see on the right side there can be severe secondary bacterial infection. You can see these pustules and crusting with some bacterial bug, and there is also swelling of the hand. And here is the, as a result of skin infection, there is the cellulitis, swelling of the whole hand. So this can be the complication of untreated scabies. So what is the treatment of this infected scabies? So in that case, you have to give the bacterial cover with the oral antibiotics, that is amoxicillin or comoxiclav, or first generation cephalosporin like cefardine, and you also need to apply local topical antibiotics to relieve these symptoms. Now coming to the prevention and treatment of prevention is make sure that there is a good hygiene. You should make sure to clean all the cloths and linen, starve the mite, and starve the mite in a way that you keep that clothings or other things or the stuff within a shopping bag for a couple of days. There will be starvation of the mite. And then oral antihistamine to relieve itching, calamine lotion which acts as antipruritic, and then steroid application in severe cases where the itching is very severe. So coming to the summary of scabies. So this is an infection or rather infestation which is caused by a mite, Sarcoptes scabiei. The presenting complaint is intensely pruritic rash, especially at night. Family history with similar complaints are generally positive. Burrowing by this mite is pathognomonic feature of this illness, and the treatment of choice is topical application of 5% permethrin. Thank you very much for your patient listening. If there are any queries, any questions, you can put them in the comment section. I'll be more happy to answer them. Thank you very much. Take good care of yourself. Allah Hafiz.